not yet reported confirmed cases in Africa. However, there have been some suspected cases which we are waiting final confirmation, and those are from Ivory Coast and Kenya. Again, they are suspected cases. We are in the coming days we'll know if actually they are confirmed. Africa, so far we have not reported cases.
All right, are we ready to deal with an influx of perhaps people that might have and might be carrying this virus? Is Africa prepared?
What I can say is that this is a fast-moving, fast-evolving outbreak of the coronavirus, which we have not seen before. And the advantage Africa has now is that we've seen this unfolding in China and other countries, so we've given us a little bit of space to prepare. So I think that we are not optimally prepared, but we are preparing as quickly as possible in a coordinated fashion with the World Health Organization. So all member states are at the very highest alert. We just conducted a meeting a few minutes ago with all member states coordinated from the African Union to check with them how prepared they are. And we continue to provide them support in the areas of laboratory testing, in the areas of enhanced airport screening and monitoring, and also in the areas of infection prevention and infection control, especially at the hospital. So we continue to coordinate our efforts across the continent while hoping that we'll be able to deal and cope with this outbreak in case it becomes a huge issue on the continent.
All right, African countries across the continent are differently resourced. Some have got more sophisticated equipment than others. What work is being done to help those that perhaps don't have the same kind of resources available to them?
Oh, that's a very good question. I mean, our strategy from the Africa Centers for Disease Control and Prevention has been a network model. And that's why I explained a few minutes ago that we just had a meeting networking the most national public health institutions on the continent, such that we can harness our assets across the continent and support countries that are less equipped to handle this scenario in the areas of surveillance, in the areas of laboratory testing, and in the areas of reporting. So we don't expect that every country will be able to do the entire spectrum of analysis and support, but with a network model, we hope that we can actually support one another and cope with this outbreak in case it becomes a massive situation on the continent.